We're here for a Women and Infants podcast with Dr. Bala Bhagavath from Women and Infants Center for Reproduction and Infertility. And today we're going to be discussing what you can expect at your first visit if you're seeking infertility treatment. Welcome, Dr. Bhagavath.
Thank you for having me.
Okay, so let's talk about a woman who first comes in here seeking fertility treatment. What can she expect at that first visit?
She will be, history will be thoroughly reviewed with the physician, and any necessary physical examination, including pelvic examination, will be performed. And if indicated, a diagnostic ultrasound examination of the pelvis, which will look into the uterus and ovaries, will also be performed. And after gathering all that information, the physician would sit down with the couple and go through the possible causes for the infertility and order any tests as needed as determined by these examinations. If these tests have already been performed by the primary care doctor before they even come to see the infertility doctor, then they may even have a plan made out, tailor-made plan made out for their condition as to what the next step of the treatment process is going to be.
Will they meet with someone besides the doctor?
Yes, they in fact will meet with a nurse before even they meet with me, have a preliminary consult with her, that she'll take the history and put everything in the computer, and then meet with me, at which time we'll go through the history and all as I explained. And at the end of the process, they will meet with the nurse again, and if tests have been ordered, she will go through the process of getting those tests done and organize that for them. And if a treatment plan is already made, she'll sit down and go through how those treatment plan is going to be instituted. So essentially, the couple may spend as much time with my nurse as with me. And at the end of the visit, they will definitely be visiting with the financial counselors as well.
And you had said couple. Should a woman who's seeking fertility treatment come in with her husband or partner? Is that an important component to her treatment?
Absolutely. In fact, we encourage every single patient to come with her partner, the significant other, whoever it might be. And the reason for that is infertility as a condition is extremely stressful, and infertility treatment process is also very, very stressful. And as a result, it is so important for the partner to be there at all times for the patient, giving moral support. If they are present for these visits, they know exactly what the diagnosis is. They know firsthand from the physician what the plan is for the treatment, and thereby they have better understanding of how the treatment process is going to go, and also in that sense are in a better footing to actually take care of the patient's emotional needs and give her moral and other support as needed.
Now, it is very stressful, it's very physically demanding, but it's also very demanding financially. Is infertility treatment covered by insurance in Rhode Island?
In Rhode Island, yes, it is covered, thankfully. In the whole of the United States, 15 states mandate insurance coverage for infertility in different forms. In Rhode Island and Massachusetts, the coverage is all excellent, in fact, and covers all diagnosis and all treatment, including in vitro fertilization. There are some states where the coverage is much less. Some include only diagnosis, some include diagnosis and just intrauterine insemination, but not in IVF. And there are others where it is optional, where they mandate that the insurance companies offer that at a higher premium, and it's up to the patient to take that. And usually in those scenarios, the coverage is not also excellent, it's just bare minimum. The vast majority of the states in the US, unfortunately, do not mandate coverage for infertility treatment, and therefore patients in those states don't have to pay out of their pockets for this treatment.
So in Rhode Island, not only are we lucky because we have such high caliber doctors, but for a lot of these patients, it's at least partially covered for them.
Absolutely. In Rhode Island, there is a 20% copay that is mandated, so that does increase the cost out of pocket to an extent. But it also comes with the advantage that there is no cap on how much, even though there is a cap of $100,000, it's quite a high cap that most patients never reach that cap in the process of their treatment. The one other caveat with the insurance company coverage in Rhode Island, though, is there are some employers who are based out of state. For example, could be Georgia or some other state that does not mandate coverage, and as a result, they may not, even though they reside in Rhode Island and work in Rhode Island, their insurance might not give them infertility coverage. So it is always encouraged that the patient calls the insurance company themselves and find out exactly what is covered for them and how much of the treatment will be covered beforehand. In addition, as I mentioned earlier, patients will be meeting with our financial counselors who are dedicated in doing just this and nothing else for our infertility patients, and they will work with them and the insurance company to determine exactly how much coverage there is, and as needed, help them with the claim process.
Terrific. And I know you've also recently introduced your Compassionate Gift program for people who might be suffering some hardship and might need a little financial assistance, or for someone who would like to make a donation.
Absolutely, that is correct. We do have this Compassionate Gift program by patients who are in our system and who for some reason unfortunately are determined to be ineligible by the insurance company to move forward to in vitro fertilization, for example, and need some assistance with that. Then on a rotating basis every quarterly, we do have this assistance program where one person is chosen as a lucky person to receive that care.
That's great. Thank you very much.
Thank you.